how much is cost of healthcare services an impediment to getting this figured out? Or is that even anymore, is it now just so written into the system, Lanhee, that, that people just assume it's going to be there, it's going to keep climbing?
Yeah, it's a big issue, and we see cost in so many different ways in our healthcare system. So for many Americans, it's premiums, and particularly for Americans that have been in some of these state exchanges, they've had some challenges around premium increases. If you're an employer-sponsored plan, which is 160 million Americans, most Americans get their insurance through an employer, your health premiums are probably going up year over year by a decelerating percentage over the last couple of years, but they're still going up. And by and large, that's the prism through which people see it. But health insurance is very complicated in the sense that it's a combination of many different factors that determines cost. And so even though people think their costs are going up, I think really it is more of there are clearly hard measures to measure that it's going up, but there's also just an impression people have that's sort of built into themselves about the healthcare system. They feel, healthcare is just getting more and more expensive, and I'm getting less and less for what I'm paying. And I think that is a very, very big part of what's animating the Republican effort on this bill right now.
How do you see the cost?
So first of all, I would agree that the Democrats don't talk enough about cost and sustainability, and those are very important items. Here's the reality, though. All you have to do is go to the pharmacy and look at what your drug actually cost, or look at the bill when your kid spent 4 hours in the emergency room, or you spent 2 days, and it's tens of thousands of dollars, to realize we have an enormous cost problem, and it's a unit cost problem. It's actually not a utilization problem. We have a problem with unit cost. But here's the ugly underbelly of this: we are addicted to the jobs in healthcare, and if you really want to take out costs in healthcare, number one, it means addressing pharma, which is a big, difficult thing to do in DC. We can talk about why that is, but it's much more difficult than it should be. But a lot of the costs come inside our hospital system, our inpatient system, and that employs so many Americans these days, and I think it's a very, very difficult challenge. So I think very difficult to get serious about it. My view on the answer to that is we got to start focusing on all of the things that cause people to use the healthcare system. Our problem in our healthcare system is not the 67-year-old jogger with 2 Fitbits. Not our problem. Our problem is the woman who lives 2 bus stops away from the dialysis center, and probably 2 bus stops away from the nearest grocery store. And if she misses her bus, she's in renal failure, and she may spend weeks and months in the hospital. We got to reinvest in those areas. We got to focus on those areas, and we got to focus on cost in a serious way. But that's not a fig leaf. We should not use that as a fig leaf for not giving people the coverage they need.